Welcome back to another episode of Your Fertility Counselor. Today, I have the joy of welcoming someone whose work, dedication, and heart have supported countless families. The wonderful Dr. Janice Tung from Thomson Fertility Center and the ONG Specialist Center here in Singapore. Dr. Janice is a highly respected obstetrician and gynecologist and fertility specialist who blends medical excellence with a deeply compassionate, patient-centered approach. She obtained her medical degree from the National University of Singapore, where she topped her cohort in obstetric and gynecology and was awarded the prestigious SS Ratnam Book Prize, one of the most distinguished recognitions in the field. Clinically, her expertise spans a wide range in the care, including the management of complex and high-risk pregnancies. Her special interests lie in subfertility, IVF and assisted reproduction, fertility preservation, and pregnancy-related complications, such as preterm labor. She has also received both the Sing Health Foundation Research Grant Award and the Sing Health Duke NUS and ONG ACP Research Grant Awards for her work on ovarian conservation in laparoscopic cystectomies, as well as labor induction and preterm labor, reflecting her commitment to advancing women's health through evidence-based practice. But beyond her impressive expertise, what patients consistently highlight is her warmth. Dr. Janice is dedicated to providing care that is value-based, holistic, and truly human, helping women and couples feel supported, empowered, and safe during some of the most significant moments of their reproductive journey. In today's episode, we talk about her path into fertility medicine, but also her insights on IVF today, the realities couples face when navigating subfertility, and how she supports women through both hopeful and high-risk chapters of pregnancy. Her wisdom is gentle, grounded, and incredibly reassuring. And I know you'll walk away feeling both informed and comforted. So take a breath, settle in, and join me in welcoming the inspiring Dr. Janice Tung. Well, hello and a very warm welcome, Dr. Janice, at our podcast today.
Thank you, Tanja. Thank you for the invite.
Yeah, we are so excited to have you here because I know that you have so much wisdom and experience to share with our listeners. But before we actually dive into that, I was just curious to know, would you mind sharing about your favorite morning ritual? How do you wake up and launch your day, so to say?
Okay. I think as with most working mothers, we kind of start out with the school run. Yes. So I have two kids. My boy was 8 years old and my daughter was 5 years old. So I'm the one that's in charge of dropping them off for school. I kind of like that time actually with them because I drop off my son first and then my girl in childcare. So it's two different runs. Yeah. So I get personal time with each of them. I can ask them about how their day was previously, what they're looking forward to in that day itself. Yeah. And I think that time is very precious. You know, we tend to steal snatches of these times. So then when I drop off my boy, he will always blow me a kiss. And then when I drop off my girl, she will give me a hug and she'll say, "Have a good day at work, mommy." Yeah. And that kind of like fuels me for the day. That's the power of you. And then straight after that, when I go into work, I can, laser focus.
Yes, yes. How precious.
Yeah. So that's how I start. I don't normally have breakfast. It's just a habit that came from years and years of medical practice. We kind of, do rounds and all this. We kind of complete like the morning task first before we settle into the first meal of the day.
Yes. Yeah, yeah. And so beautiful, actually, that you still manage to get a little bit of time for yourself then before you really start working.
Yes.
That's great. That's great. Now, for those listeners that actually might not know you yet, can you share who you are and where you're based and what you do?
Hi, I'm Dr. Janice. That's what I like to be called usually because my Chinese surname is a little bit difficult sometimes to catch. People be like Tung, Tung, or what. So I just like Dr. Janice would do. Yes. So and I feel it's a little bit more personal because I feel that especially for fertility patients and their journey is very intensely personal, and I like to be included in their support network. I think it's very, very important that I'm always there for them. So that's why I use a first name basis. Yeah.
Mm,
The doctor is just yeah, so the thing is, then basically I am an IVF specialist. I'm accredited, and I practice at Thompson Fertility Center, as well as my own private practice at the O&G Specialist Clinic, which has a huge fertility focus in itself. So we see a lot of fertility patients, or rather couples with issues with fertility or having difficulty conceiving. And I have years of experience in that. And I am also managing the pregnancies that follow. And so since these pregnancies tend to be of higher risk, some of them have gone through repeated pregnancy losses, or they could be multiple pregnancies, or pregnancies with underlying medical conditions. So we will also follow through to delivery. And I find that especially fulfilling and satisfying because um, I feel that if it's a journey all the way from before they conceive to the time of delivery, you see that where they're coming from, how far they have come. It's very, I mean, that in itself is very satisfying and fulfilling. You don't need anything else actually. Yes.
yeah.
Yeah.
Yeah, and it's so true what you're saying, this fulfillment of helping and supporting these couples on their journey, and then at the end holding that little bundle of miracle, right? It's so, so beautiful. Yes. Yeah. What
Yeah.
actually I was curious to know. So what prompted you back then to decide, you could have become a doctor in so many different medical areas, right? But then you chose to dive into fertility and pregnancy. What made you actually decide to become a doctor in
Yeah,
ONG?
that's a very interesting question. I mean, there's no eureka moment like, oh, I want to do this. It's actually, I feel there's some natural affinity to the
Mhm.
whole process. Generally, I come from a big family. So family is a huge thing, and we're very close knitted. I have three sisters. Yeah, all my grandmothers outlived their partners, who was like the grandmas, and then my mom. Yeah, so I mean, women's health sort of just became very relevant. And then from there, of course, also when we were doing the postings and things like that, I found the subject matter quite easy. I got a book prize, the SS Ratnam book prize. I think for those of you who may not know, SS Ratnam is the founder of IVF, in the IVF program in Singapore. I mean, uh, people are naturally drawn to what they excel in a way, I guess. That's how I sort of like got into this whole thing. Then, of course, I have to thank my mentor, Dr. Lo Xiong Fei. He's the founder of the ONG Specialist Clinic, yeah, who gave me ample opportunity to do what I like to do.
Oh, that's wonderful. That's so, so great. And it's so great to hear also that you chose really an area that came very naturally to you, it seems, right? Yeah.
Yes.
Yeah.
Yeah. I think, yes, I am very fortunate to be in a position where I am doing what I like every day. I'm not sure. I think there are people who are not in these kind of positions, and it might be quite tiring, I think, to,
Mm,
drag yourself to work. But I feel the work if you can call it work, it sort of energizes me. So like
Yeah.
the patient's stories, and they energize me, their courage, their gratitude,
Yeah.
everything. Yeah. Mm.
Yeah, yeah, absolutely. Can you perhaps share with us how do you help your patients when they really struggle with fertility, and how do you guide them through the process?
Mm. Okay, so the thing is, many of them will first come with a lot of anxiety or
Mm,
uncertainty. It's just fear of the unknown, fear of the uncertain. That's a very natural fear. I mean, in Singapore, especially because we have often taught, based on merit. If you work really hard, if you study really hard, you're going to score in your
yeah.
exams, you see. But this is not something that, if you work very hard, you're going to always have a result. Yeah, so I think a lot of people feel very defeated
Mm,
with that. Yeah, and that comes with all the uncertainty, anxiety, and on top of that, because you do not know if you're just going to, like, if you give a medicine and it's 90% effective, then you're
mm,
fine, with however much you need to pay for it. But if you're having a treatment where the if effectiveness is sometimes less than 50%, or then you're going to be concerned about the costs that you're investing in this treatment, and also the physicality of it. There's a lot of physical burden from the treatment, and unfortunately more of it falls on the woman and not our male counterparts, in a sense. The needles, needles for the hormone injections, the hormonal side effects. Yes.
mm,
So really the physicality of it all. Yeah. So this makes our male partners actually, they actually have a sense of helplessness, because I
mm,
mean they're not um, taking part in the physical burden, in a sense, the physical process of it, but they have to support their wives through it. They see the pain of the needles and the side effects that they go through. I'm sure they don't feel really good about it at all, and they can't help that much in that sense, to take away that, you see. Although of course, emotionally and mentally they can just be present, you see. So
mm,
I mean, there's all of that. Then there's also the feeling of inadequacy, in a
mm,
sense, because I think, unlike other medical conditions, having a baby is not usually thought of as a medical necessity. It's not. It's considered to be a very natural phase of life, part of life. So, like, nobody thinks much, when you have cold, virus, and you go and take some cold medication. You just, it's recognized as an illness. But if you are not able to conceive and you have to go and take all these medications to try and help, you somehow feel your body has failed you in some way. It's a little bit different from recognizing it as a illness. Yeah, and sometimes this actually makes some couples not come and get treatment, or take very long before they decide to come and get help. Because they just um, feel it's not, it's like something that, their bodies are failing them. It's not a problem that they're having that they can try to resolve.
mm,
And so because of this, uh, um, uh, we have to, when they first come in, we have to make them understand what, fertility treatment is actually about. That it's not so much that they are inadequate in any way, or they're, somehow their bodies have failed in some way or another. It's to
mm,
let them recognize that it is a common problem. It is a medically recognized problem. There are issues associated with it. We may not understand everything about it, but there are treatments that we can do that can help. It may not have to be IVF. It can be some medical treatment. It can even also be surgical treatment to correct, structures of the womb and ovaries, cysts, fibroids, polyps, any of these
mm,
things to optimize the environment for a pregnancy to happen. Yes.
Mm.
So I think once they understand that, they're more or less able to cope better with the fact that they have to get some help. Yeah.
Yeah. And I think it's so, so important what you just said now. It seems to me that almost like the way how you explain it, that sometimes this barrier seems so high to actually make that first step into making an appointment with an IVF specialist because they feel so much ashamed about even sharing that they are not, they are having difficulties to conceive. So,
Yeah.
how do you think what could help possibly to actually lower that barrier? I'm just thinking about because it's really, I think the way how you explained it, it seems to me that they are putting off their plans and then waiting doesn't really help.
No, it definitely
Because
doesn't.
the
Yes.
sooner they come and see you, the better you can help them, actually.
Yes, that's right. So the thing is it's actually better now because there's more awareness, there's more
Mm.
fertility awareness. I think government campaigns, I think individual groups, individual fertility support groups, and actually the whole fact that the population age for starting family has sort of like moved
Yeah.
beyond, and there's so much news media, social media out there that I think the awareness really helps. So we do have couples coming forward to seek either at least a medical opinion or just to get a screening done, just to make sure that there are no major hindrances, or yeah, so that early detection can help to save time. Like with any other medical condition, early detection is going to help with early treatment, is going to help with your prognosis of your outcome, the success of the treatment. So yeah, so because of that awareness, they come in for early screening and therefore early detection. And yeah, so yeah, very important people like yourselves, the fertility support group. I think in Singapore, we now have a very strong fertility support group, because last time I think was quite disparate, but this group has sort of like managed to consolidate a lot of resources and information together and become, basically deploy a very wide network. So I think all of that has helped a lot. Yeah.
Yeah, absolutely. Yeah, and it's so great that this topic is being really addressed in various ways, whatever. There is something in for everybody, I feel now.
Yes, that's right. Yeah, even
Yeah.
just random news article, or yeah, especially social media ads.
Yeah, that
Yes.
helps.
Yeah.
Absolutely. You
Hmm.
were explaining before about like the more like the medical aspect and how to manage the needles and that aspect. I was wondering what's your view and how supporting these couples emotionally when they are going through ups and downs in a fertility journey?
Okay, so I have a few principles. I guess
Mhm.
I don't know what we call them, but as I was mentioning, I try to be there, be present. I think that's like extremely important because the main thing is I do not want them to feel like they're just a statistic. That's because it's so intensely personal, the journey. Yeah, people with work, with relationship goals, with career goals, with life goals, and their family goal is just one aspect of that, you see. So I try to be very accessible in one way. I mean, of course, there are limits, because I'm looking after a whole group of couples, but basically, I try to be, accessible via emails. I like emails because generally, it can take I can take my time. Like it's not a text or a message that comes through. You see, I can. It stays inside the inbox and I can have a look at it whenever. So I make an effort to really check my emails and reply. And it could also be just making a call after unsuccessful outcome result, or providing a detailed report or debrief regarding that. And I don't like them to come down, especially for appointments sometimes, because it's very troublesome to make an appointment, to make time off for the appointment, to come down all the way for it, and then after that the waiting time in the clinic. Yeah, so if it doesn't require a personal in-person consult, I can do a lot of I do a lot of online communication. Yeah, just
Oh,
to make it, yeah, easier, because it's already so stressful. There's so many things they have to deal with. So I really try my best to do that. And that is, in a way, is being there, because I'm keeping them in mind. Yeah.
mm,
So I will know if they have had their result, and then when I give them a call and all that, I mean, I feel they appreciate it. I think they do. Yeah,
yeah,
because
I'm sure.
yeah, right. So it's just like they're not a statistic on my book or something like that. You see, yeah, there are people that have just received a bad news. Yeah, so
Mm,
that's one. And then it is so, in a way, when I'm there, it feels like as though I'm actually, all the time I feel like I'm walking through the journey with them.
mm,
Yeah, like and then some couples are okay with me just accompanying them. Some will require a bit more hand holding. Yeah,
mm,
so I find that being doing it this way allows me to really, really keep track of what's going on. And I feel that naturally tends to lead to better outcomes as well, because you're more aware of how to do better in their
mm.
treatment plan. Then I also try to be as knowledgeable as I can. Seriously. So I can offer the best information and expertise to them, because if you are, in their shoes, I feel that if I was receiving a treatment, I would want to know I'm in good hands, good, safe
Yeah.
hands. Yes. And knowing what to expect as much as possible. Yes. And planning. So I feel that is important, because I don't rely on them to gather as much knowledge on their own as possible. They are not professionals, you see. Yeah, but we have the ability to go through evidence and all that, because that's what we're trained to do and taught to do, you see, and then to synthesize that information for them.
Mm,
Yeah, and I feel that having them being informed of this does help them to cope with the whole emotional liability of it. Yeah, because um, if I mean, we already do not understand everything. If we do not try to grasp what we actually do understand, then we are just all floating around in space. I don't think anyone will feel very secure. Yeah. So yeah, I think that helps. And then also I try my best in within the limits of a consultation time and all that, to just offer some words of hope and encouragement, and
mm,
remain positive. Yeah. Because it's quite possible to feel defeated, in the process, and negative. Yes. So
mm,
I strive to give them some hopes. I allow them time to process, to regroup. um, but I also need to bear in mind that fertility is time sensitive. There's just no way around that, you see. So I need to help them pick themselves up quickly, to
mm,
then move on, so that way they have better chances of achieving the end goal. Yes. Yeah.
mm.
Because sometimes if we just you know I don't know, if let's say they go through the process and then they have a pregnancy, but they somehow lose it, it didn't work out. It's very often that they can feel very, very discouraged by the whole process. And then if you don't walk with them, if you don't follow through and you don't help them pick themselves up, it just, they just go,
Yeah.
they just go. And then and if you let them go, it I mean, they're often not going to continue. And when they don't continue, it's very often that they in the end don't land up with yeah, achieving uh what they wanted to at the end. I mean, it may not always work out, but I think a lot of times people give up a bit earlier, that because of
Mm,
all the emotional and mental burden, rather than anything else. Yeah, and giving up a bit too early is I I have to say that um, I try my best not to let them do
Mm.
that in that sense. Yeah, by giving
Yeah.
them that ability to pick themselves up. Yeah.
And this is so important because, as you said, like, if you don't actually follow up with them after a disappointing outcome, they disappear. But it may be that they disappear from your appointment schedule. But also, I feel that it can also affect them really emotionally and mentally because they feel not important enough, maybe, or they feel like not being on the radar anymore, or they feel not being included anymore. So they feel like I failed, and here we go. I'm in my cave again, where I was. I feel isolated and I can't talk to anyone.
Mm.
So this is where I think it's super important for doctors like you, but also like counselors like us, actually, to reach out to them and make them feel that it is important to actually talk about it.
Yes,
Yeah,
definitely.
because they are what they're really doing is really grieving about a reproductive loss of a pregnancy that didn't happen.
Mm.
It doesn't even have to be a miscarriage. Sometimes it's just grieving about those embryos that you didn't get, or you grieve about like a partnership or a relationship that gets lost in translation while you're on a fertility journey, or you grieve about not having that dream fulfilled of a family that you once hoped to get.
Yes, definitely.
Yeah.
The sense of isolation and longing that's associated with this difficulty, right, is yeah, I mean it requires a support from everywhere that you can
Mm.
get it from, and that's why I often try to be included in that support network
Yes.
in a way, yeah, because so that you're not abandoned, by the
Yeah.
whole team. Yeah,
Yeah.
yeah.
How do you manage? You mentioned about like to keep positivity and hope, but I often find that it's a very fine line between doing that, but then also without actually promising any outcome because we don't have that crystal ball where we can guarantee them that they will have that baby.
Mm.
Um, After putting in so many financials, after going through all those medical appointments, and yeah, we are here and we might be the expert in fertility journeys, but we don't know what the outcome really will be. How do you manage a fine line of really managing those expectations in a good way?
Um, okay, so the thing is, I often do a lot of what I like to call fertility planning.
Mm,
The thing is, it's very natural to expect more from an embryo transfer in IVF than from a natural cycle. In fact, people say that the couples are actually expecting 100% success with
mm,
IVF. It's a common misunderstanding that IVF gives 100% success, but actually, I don't think couples have that misunderstanding. It's not so much a misunderstanding as a more natural inclination towards a higher expectation for embryo transfer, and that's
mm,
very natural, you see. So I just need them to understand that, what are the chances with embryo transfer over natural trying, and to have a plan for going forward if, let's say, a natural cycle doesn't work out, or a IUI cycle doesn't work out, or a IVF cycle doesn't work out, you see. I don't. In fact, I tell my some couples with who are doing IVF that you may just well get pregnant naturally as well. Yeah, so you don't in a cycle where you're not doing any treatments, you could be trying naturally.
mm,
So the idea is to let them understand the science of reproduction as at the very basics at least, and then in that sense, I feel that with the understanding behind the science of it, it helps one to motivate them
yeah.
naturally, okay, to naturally try. A lot of them, they just give up trying naturally because they think it's so tiring, it's not working out anyway, I'm doing IVF anyway, that kind of thing. But when they understand how the science works, they will be more motivated to try as well because they understand that it could just happen like that. And then the second thing is, besides motivating them, it also helps them to deal with disappointments because they understand that it's not something that they didn't do, that they did do, that they, like, or like a single factor that went wrong in the whole cycle, which, I think a lot of them, they sort of like keep ruminating over that that bad milk that they drank or something like that, that happened in that cycle. Yeah. So, and very often we know it's definitely not because of that, you see.
Mm.
So understanding some science behind it, I often do a lot of that, and then planning a treatment. I mean, not say treatment plan, it's really like fertility planning. Even for couples who are not haven't even embarked on IVF, they're just coming for fertility screening and all that. We plot out time frames, Of course, I'm not I tell them, I mean, it's not like I give them a time frame or anything. I tell them that you have to, based on your work circumstances, your social circumstances, and everything, it's like they can look through a year's schedule and say, okay, maybe April, my month, my work schedule is light for both of us is lighter. Okay, maybe
Mm.
if I have no natural news by then, I will do an IUI cycle, for instance, to augment my natural time. Something like that. If 3 eggs come out in IUI, that's as good as 3 months of trying,
Mm.
to make it more efficient. So I do a lot of that planning inside so that they're not lost.
Yeah.
Often they can't, a lot of people, they go for screening or fertility screening, and they're just given the information like, oh, all your fertility tests came back as normal. That's it.
Mm.
Go back and try.
Mm.
Come back if there's no news. I I tell them, you need this kind of thing so that when their menses comes, they're also not so hit with like a feeling of loss. What am I going to do next cycle?
Yes.
Yeah,
Yes.
yeah. So and this is like, the grasshopper and the ant
Mm.
story. If you plan, actually, I feel, I mean, I think studies have shown, psychological studies have shown that planners are actually sort of more in control of their life. They're actually happier, less anxious.
Mm.
People have this, I mean, that's a misunderstanding where, people who look very caliphate and all that, they're actually happier people, but not necessarily.
Yeah, and I think it's such an important point because often when it comes to IVF and especially embryo transfer, a lot of women start realizing that it's really out of control, of their control. There is no way that you can control anything about aspects in embryo transfer, except for your sleep, your good nutrition, good lifestyle during those 2 weeks waiting time, right? But I
Mm.
think the planning aspect that you just mentioned now can truly help them actually to feel kind of like more self-confidence and stronger in terms of like going into an IVF. Yeah. Something you mentioned, Dr. Janice, I was wondering, in terms of misunderstanding, do you feel that there are any other misunderstandings that are really common in IVF that you feel like this is a repetitive misunderstanding that you are actually seeing a lot in your
Yeah.
practice?
So there are a few.
Okay.
It goes both ways. There are some people with the misunderstanding that IVF produces healthier babies.
Mm.
That somehow the best egg and sperm is selected for. Chinese people tend to believe that. And then the other way, which is that it actually may lead to less healthy babies because we're doing something artificial with them.
Mm.
Yeah. So actually, it doesn't do either. Doesn't necessarily lead to healthier babies or less healthy babies. Yeah, it's very much like another means towards trying to get pregnancy, trying to conceive. Yeah, and it's particularly useful in certain people with issues such as blocked tubes, low sperm count, because IVF can overcome these issues more easily. But if, let's say, for certain people with unexplained issues, because it's just very long time not conceiving, all the tests is normal. Yes, they could have an age factor, an egg quality issue, or a sperm quality issue that it's not detectable on the test. Then in such groups, their IVF has a bit of limitations. So yeah, it's just another means towards pregnancy. So it doesn't really give you healthier or less healthy babies. And in fact, if you look at you won't know who's an IVF baby and who's not. Maybe you
Yeah.
might see the twins and think this possibly is an assisted conception, but they're natural
Yes.
twins.
There are, yes, yes.
Yeah. Oh,
Um,
yeah. Speaking of which, yeah, in terms of one more misunderstanding is that some people think that, oh, IVF, get twins for sure.
yes.
Yeah, yeah. In fact, I know some people want to do IVF to get twins. And I was like, actually, even though, yes, I mean, any fertility treatments, by virtue of the fact that they are meant to try and help to get pregnant and therefore increase pregnancy rates. So therefore, they will have this natural side effect of having an extra pregnancy or two. The idea is that the actual likelihood of multiple pregnancies is actually very low. Yeah.
Wow. Yeah,
Mm.
that's a really common misunderstanding then.
Mm.
Absolutely, because I hear many women actually say like, "Oh, I opt for IVF because then I can have my twins, and then I have my two kids and done and dusted
Yes,
with
exactly.
one pregnancy."
Yeah. So
So
then they're
what you're
setting
saying,
themselves up for disappointment.
yeah, yeah, another one. Well, I hope one would hope that also for those women who then get pregnant, even by transferring two embryos, but getting one baby at the end, which is healthy, that actually gives them the joy and the reward as well, and the fulfillment, hopefully.
Mm.
Yeah.
Yes, yes, yes.
Um, you mentioned about like that information can be really a great tool of empowerment of your patients.
Mm.
And so does also, I believe, the planning that you do with them. Are there any other methods or tools that you use to empower your patients for their fertility journey so that they really feel also that they are in the same boat with you?
So I do I mean I do sort of like tell them to find their support network. So
Mm,
if and the partner should definitely be included in that. So I tell them not to lose sight of each other. In fact, I think one I mean one very interesting aspect I want to is I'm seeing couples from all walks of life and the way they communicate and their relationships and the way they manage their relationship. So it's very interesting actually. Yes.
mm,
And I think there is some couples who will do better than others in this
mm,
aspect. Yeah, I think it's really very, very important that they do not lose sight of each other. And so I try to sometimes we may need to even like act as a mediator, negotiator in between the two. Yeah. And then we also yeah, and then getting them involved in the fertility support group networks or even a professional counselor like yourself, especially if we feel that they do need to talk to somebody, yeah,
mm,
professional, professionally trained to walk them through this. Yeah, because there's no way we can do that in the limits of our consultation, not to mention we are not trained also. I don't believe I personally am very good with words of encouragement and things like that, and strategies used to help with relaxing the mind and things like that. So yeah, so definitely we direct them to you, and then I ask them to find like-minded people as well,
mm,
forums, even friends or people at work who may be going through the same thing. Yeah, I that really helps them a lot because it's always so isolating. And when they find out that there are people around them who are having similar issues, of course everybody's journey is different, but the idea is that they don't feel so alone. Mm.
Yes, absolutely. Yes, absolutely. That's so true, actually.
There's some power in numbers.
Yes, yes. Can I ask you, Dr. Janice, you just mentioned about like those couples that where you feel like their relationship is really in sync and others maybe less so. Can you see a difference when they are emotionally in the right space versus others that are maybe not so connected yet and the outcome of the IVF program? Can you
Mm,
see
yes.
that how this actually has a more positive maybe impact? I don't know.
Um, I think the very main thing, right, is how quick they are able to get over a disappointment or a
Okay.
loss. Yes. So since time, since fertility is time sensitive and the time intervals between tries are important, uh, uh, that's how it would affect the outcome in a way.
Mm,
Yeah, how it impacts on the outcomes because people who are not so connected, they take much longer,
mm,
much longer, and in that sense, you might lose opportunities in a way. Yeah, but I mean,
yeah,
everyone takes the time that they need to, so we also cannot, um, force them or anything like this. Yeah,
yeah.
you just have to, yeah, keep going at it. Yeah, and try to. I do find myself sometimes in certain situations acting as a yeah, a go between. Yeah. Mm,
Yeah, and I think that's sometimes probably also the challenge for you as an IVF specialist because you see exactly how it's laid out, right? And you could see how if they wouldn't take a break and would continue, how this could actually ultimately lead to the successful outcome that you are all hoping with. But then at the same time, you're seeing that your patients need a break. And it's like almost like having that courage, but also patience to actually hold the space for them
yes,
when
that's
they need it.
that's
Although you might have a different view on it, but I kind of like feel that there could be sometimes a dilemma. Do you feel like that as well?
Yes, definitely.
Mhm.
Yeah, because we have seen so many patients on the let's say for one of a better phrase on the other side of the shore.
Mhm.
Okay, and how far they've come, we and we yeah, we know that because they don't see it, they are on the other end right now, but because we have seen so many, on the other end, on the destination, and and they can't see it, they can't, and it's not nobody's fault that they can't see it, yeah. So and I can't, if I could guarantee an outcome also, that'd be fine, but I can't either. Yeah. So but I do know that if you don't move, then you're not going to get there, right? Yeah, at all, like with any chances. So yeah, definitely have to I that's why I say it's in a way I strive to, yeah, but one
Mm,
thing that's for sure is to not to follow up. Yes.
yeah.
Yeah. I don't generally leave them to it. Yes. Yeah.
Yes,
Yeah.
and that's so great because I think a simple check-in and just
Yeah. Just
asking,
a
how
check-in.
are you? And I think that can really help to move that needle in
Mm.
many of these cases where they feel stuck.
Mm, yes. I think personality plays a huge part as well in what, because it's actually a bit of a resilience.
Mhm.
Yeah, this it's in a way a crisis situation or disappointment, grieving as you put it. So some resilience and perseverance is needed, and that can in a way I won't say it needs to be inherent in the person. People can be trained to be more resilient or taught to persevere with
Mm,
something. Yeah, so we try to do a lot of that. And then as I think, like for instance, some people are more scientific minded and some
mm,
people are more artsy. Yeah. So I find the scientific people are actually a little bit more able uh, to handle these things associated with fertility issues and pregnancy. Like for instance, to give an example, we have a science teacher, and I think she went through like 5 miscarriages. In fact, one of it was quite bad. It was a triplets from IVF, and it was like she kind of like the heartbeat stopped for one, and then 2 weeks later, heartbeat stopped for the other, and then even
Oh,
at 12 weeks, the final, that so-called, people say after the first trimester, yeah, she lost the last one as well. So you can imagine if this had happened to, I think, anyone else, how emotional it would have. But she was a science teacher, and she took it as it was, like,
wow.
why the pregnancy didn't work out. It was the embryo. It's not a healthy pregnancy in the first place, not a healthy embryo. I mean, I want a healthy baby. This pregnancy doesn't work out. It's good that it stopped this way, and then she
Wow.
moved on, she just moved on. I'm glad to say that she has a little baby girl now. Yeah. So anyway, the thing is, yeah, she just kept moving. Yeah.
Yeah.
She's just able to process it scientifically. Okay.
Mm.
I don't think there's a best way of processing or anything. So for this, they're quite kind of easy for us. Yeah. But the ones who are more emotional, they are not able to see this kind of pictures. We have to present it to them in another way,
Yeah.
and to let them take their time, and then slowly get them back on their feet. Yeah.
Yeah, absolutely. This is where you have to adapt your language and vocabulary, even like tonality and
Yes.
everything, right, to these patients.
Yeah, I
Yeah.
would say I was always the best at it. It was a learning process as well. I think still learning.
Yeah, we are all Dr. Janice. Yes. And any advice on what patients could incorporate in little habits, maybe daily habits that they could do to really build on that resilience that you just mentioned? Because I feel resilience is really like a great support to have when you are embarking on a fertility journey. Is there
Mm.
anything that worked extremely well that you have seen with some of your patients, what they are doing? Could you share?
Um, so I give them one macro picture, which is that it's actually a balance, as you mentioned. It's balance between making the fertility treatment a priority, or focus, because you need to prioritize it. You need to have the time and mind space for it. If not, you're just like, oh my God, I have this work commitment, I have that work commitment, and it's just like you can't even make time for a scan appointment. Yeah, and we are really streamlined the process, so much to try for you. So you have to it still has to be somewhat of a priority or focus, so that you can clear the time and mind space for it. But yet it cannot be the singular focus in your life,
Mm.
because that is definitely going to do things to your mind, to your mental resilience. So the thing is, you have to defocus beyond that. So I think it's more like those myopic glasses. There's the focus, and then the periphery is defocusing. Yeah. So your other aspects of life should continue. Uh,
Yeah.
um, don't don't stop travels, don't stop living. Yeah. So do what you want, go for that course, flower arrangement, whatever that you want to do. Yeah, and then we will plan it in,
Mhm.
around your travel plans. And then always communicating with your partner. Yeah, and talking with like-minded groups, small little things, and recognizing when you might need to speak to someone professional. Signs of signs of the stress and anxiety getting to you, or sometimes we pick it up in the consultation itself. Yeah, and then managing their sleep, because stress is very hard to quantify. Work stress, life stresses, and everything. So it's very hard for them to say, to manage that. So I just tell them one very simple thing, which is to try and see if they can get 6 to 8 hours of sleep a day.
Ah,
Okay.
yes.
And if you're not getting that, then yeah, they're gonna need some help. They need to um, do something, yeah, with work schedule or their daily schedules to see what's going on, or maybe just the phone usage, yeah, all right, things like that. Yeah, so just managing the sleep, number of sleep hours, and I think that just naturally helps a lot already. Yeah, instead of feeling so exhausted every day.
Yes,
Yeah, and then
absolutely.
I don't really require them to do intense gym exercise and all that, because obviously all of us are not. I myself am not there. So staying active,
Mm.
just yeah, don't sit on the couch after dinner and just pick out in front of the TV. Yeah, get out there, take a stroll, things like that. And then being no need to diet or like very intensive management of what you're eating and all that, but just being mindful of what you're putting in yourself. They know it, they cannot be eating like cakes and ice creams and fast food every day. Yeah, so it's just being mindful, but yet I don't want them to like, oh my god, I can't eat
Mm.
that one cake that I want to eat. Yeah, they don't have to do that, you see, as well. Yeah, they just need to be mindful that they can't be doing that every day. That once in a while. Yeah, so that's how, just simple things like this. Mm.
Yeah. Yeah, that sounds really well balanced. And this is also something that can be really helpful, especially when being on an IVF journey, because with the appointments and everything that goes around that can be stressful per se already, right? So
Yes,
uh,
very for them,
you
I
don't
feel.
want to add anything else that could actually come across as stressful. Absolutely. Yes. Well, it's absolutely wonderful because I hear tender loving care coming from your side. I also hear a lot of support in planning. I really love that. And I know that you are also really specialized in high risk pregnancies. So maybe before we wrap up, could you share a little bit about like what high risk pregnancy means in your space with your patients?
Um, in general, there are pregnancies that may run into complications or problems at the later part. So generally, any certain risk factors are identified. For instance, age, because that predisposes you to high blood pressure in pregnancy, diabetes in pregnancy, as well as risk of stillbirth, things like that are higher with just the age alone. And I am for that, a lot of it is actually associated with the age of the egg.
Mm.
So if you are older but using a younger egg from an IVF, for instance, that's possibly helpful to reduce the risk.
Mm.
And then as well as multiple pregnancies from yeah, maybe from the assisted reproduction treatment, as well as people with repeated pregnancy losses for whatever reason at all. It may not be first trimester miscarriage, it may be a second trimester miscarriage from cervical incompetence, or it could be just a bad pregnancy history. Babies with previous anomalies, or bad outcomes from certain pregnancy deliveries, like a very severely preterm birth, rupture of the pregnancy, the placenta. So all of these people will fall into a group where their pregnancies should be more closely monitored. Uh,
Yeah.
and there are certain medications that might need to be given early in the pregnancy in order to mitigate such risk. And in general, even the fact that it's an older mother carrying an IVF pregnancy with bleeding in early pregnancy, they're more precarious. I
Mm.
would use the word precarious rather than high risk, actually. Yeah. So so for that reason, more caution is
Yeah.
needed. Yeah, it's just actually really I would prefer the word precarious. Usually I use a lot of that. Yeah. It so I feel that, some people, they are like, I was pregnant, what, I walk around, I work, I went to the gym, I did 10,000 exercises
Mhm.
a day, I walked 10,000 steps a day, my pregnancy was fine, my baby, I delivered, and my baby was okay, everything's fine, why is yours any different? Yeah,
Mm.
yeah, but it's just that everybody's bodies are different. And so some pregnancies are going to be more precarious than others. And so, in a workplace, especially, so I feel that, workplaces, sometimes they need to understand that,
Yeah,
yeah, some pregnancies are just going to need a lot more caution than others. Yeah, so not all pregnant ladies are the same.
yeah,
Yeah,
and
especially bosses with their, wives who are like, oh, my wife's pregnancy went fine, or actually everything okay. Then you look at your employee, why do you need so much leave? Why do you need this? Why do you need that?
Mhm.
Yeah, it's, I mean, it's natural. I mean, I think it's a human aspect to compare. Yeah. Yeah.
yeah,
So we try to support them by getting understanding from the workplace, the kind of leave they need, in fact, like growth restricted babies, basically pregnancies that are not doing very well later on in the third trimester, they are growing very slowly. Yeah.
mm,
Yeah, babies are supposed to be being pop out at like 2.5, 2.5 being a low standard right now. It's like 3 kg, and above. Yeah, so but there's babies that are like 1.6, 1.7, or even lesser than that. Very slow growing babies who are not growing inside, So actually I find that sometimes they take off from work, they eat better, they rest better, and it gets better.
mm,
Yeah, yeah, so it's they need that kind of support. And then the other thing is also, um, because we are so well versed in giving the medications that are needed, in handling the kind of medications that are needed, to us it's so commonplace. It's like,
yeah,
we know when to give it, what to give, who to give, how much to give. So uh, we're not scared to give it. Yeah, so I mean that makes it I mean, I would say that, yeah, if you're in a clinic full of this high risk pregnancies, then um, um, the kind of support, I guess, you can get for the pregnancy would be um, more well managed in a sense, and also less scary.
yeah,
To another more low risk a clinic with more low risk pregnancy, occasionally they have that high risk, but it's like everybody's going to jump in on that person,
mm,
and like, yeah, so we are also very careful to make sure that we don't just like, you know uh, uh we are able to recognize what is very very high risk, and what is, just, can be maintained, and with more closer monitoring and things like that. So this is I think that's the advantage of uh, yeah, being in a clinic which looks after such kind of pregnancies more often. Yeah.
yes.
Mm.
Yeah, definitely. And I think you can help your patients also to feel calmer and reassured because of the vast experience that you have in this field. And I think that can make a huge difference, right? It will be
I find that it does. Yeah, it does.
yeah, it's
Yeah.
absolutely critical that you as a doctor remain calm and remain composed and grounded when everybody around starts to actually become very, very nervous about the pregnancy.
Yes. Or
Yeah.
sometimes when a patient's actually too chill.
That's the other way around.
Actually, too chill.
Definitely.
Kind of have to deliver.
Agree, agree. So, Dr. Janice, I would love to know what is the part that is the most rewarding for you. Can you share that with us?
um, I would say a single moment is the most
Mm,
rewarding or inspiring in this whole in this work that I do. It's actually moments. Yes, golden moments. So generally, like for instance, if I'm meet a couple with their twins at a shopping mall or along the hospital corridor. Sometimes they're like, "Hey, Dr. Janice, do you remember these twins? Yeah, you're the first person to see that." And then they will tell their kids, "Oh, even though, yeah, sometimes they're like, do you remember her? She's the one who saw you first." Yeah, so that in itself is very rewarding, and I'm sure any obstetrician would also feel that way. Obstetrician, as in basically the specialists who deliver babies, and then also other moments where at the point of delivering them, whether it's a cesarean section or vaginal delivery, you see so much happiness. And being a fertility specialist, because I've seen them before they conceive, and kind of like know how far they came from the that point where there's just so much happiness when they look at their baby, that is truly golden. Yeah. And you just feel yeah, that in itself is so rewarding. And
Yeah.
and then we have the couples who I mean, these are the success stories, and then of course we have couples who also have not succeeded yet. And some of them will be giving me little postcards, thank you emails. Sometimes we drop off little gifts even. And the I mean, it's just to let me know that I've helped them in some way. And I feel that is truly, truly rewarding as well. It's so touching. Yeah.
It is.
That they take the time out of their uh their mind space. I mean, they cannot, I mean, because if despite the outcomes, they're not only looking after themselves, they are also sparing a thought for me. Yes. And I feel they're keeping me in their thoughts as well, so that's really something that goes both ways. Yeah.
Yeah.
I feel very, very touched and honored, actually, and privileged to be in that position. And then yeah, so it makes me feel that every child is a miracle,
Mm.
and that nature's miracles, the science behind nature's miracles, does not actually lessen the wonder of them. The thing is, I have always been struggling to try and find um, a common point between IVF, and the end point of it, which is, a baby, a new addition to the family. There's so much science about IVF. It's so clinical, and it's I know some couples who approach it, they find that, it's such an artificial means. In fact, they call it artificial reproduction, which is really not a very good word last time. So that was, they've changed it to assisted reproduction. Yeah. So the thing is, yeah, it is not, it's just the science behind it. And I was having some inspiration the other day from my colleagues, because they were considering going to see the Northern Lights for their holiday. And the Northern Lights, they are, it's a scientific phenomenon. Yeah. So and to me, suddenly I realized, hey, actually, the science behind nature's miracles, it doesn't lessen the wonder of them. You go there, you
Yeah.
see the lights, you don't think about the science behind it. Yeah. So yes, in that way, yeah, it's truly rewarding. Yeah, what I'm
Yeah.
very, very fortunate to be doing, what I to getting to do this. Mm.
Yes, and it really feels like that, the way how you actually explain it, and one can see it in your expression and how it really touches your heart. Yeah, absolutely. Well, thank you so, so much. Before we actually wrap up this session today, I have one last question for you. Actually, two. Sorry.
No worries.
One would be, I'm curious to hear from you, Dr. Janice. You have a day to yourself, and I'm fully aware you are a mom of two, and this might not happen. But if it's for some magical reason it can, what would you do with your day to yourself?
Uh, I was just going to say that I can't remember when was the last time I had a full day to myself.
Of course.
Because I don't I don't think I have in a very long time. There's always something to do. There's emails, there is phone calls to make. As told, I strive really very hard to be there for my ladies, so I don't yeah, so I will. And because when during work office hours, you have to run the clinic, you have to be doing procedures, you have to what. So a lot of this actually I have to put it outside of that schedule, yeah, in order to be able to have the time for it. So yeah, in that sense, that if I have space, that's what I'm doing, you see, as well. And so let's say if I were to really pick something that would I would do, actually generally I would spend time with my kids.
Yeah.
Yeah, because I feel that I don't know, I think they uh it makes me very happy.
Yeah.
Yes. I'm not talking about like the getting them to shower, getting them to brush their teeth, but that drives me nuts, getting them to do their homework. Yeah. No, not that. That really will drive anybody mad. Yeah. So but like, having the day off and then just spending a time playing with them or doing some activities together or going to a water park or things like that.
Oh,
So very relaxing.
oh, so beautiful.
Yeah,
Yes.
it
That's
almost feels like a holiday. That's if I'm not really actually on overseas with them. Yeah.
Yeah, yeah, that sounds really beautiful, actually.
Yeah.
Last question that I have for you, Dr. Janice, is like, will you have like one final advice of encouragement to those that are actually on a fertility journey?
Oh, actually, I mentioned it earlier. I was
Mhm.
just talking about really getting your support network in place, and including your partner. I would say you should include your medical team in that as well. The doctor, the nurses, as hopefully they're willing to. And
Yeah.
then yeah, when you need a professional counselor, and definitely if you have some like-minded friends or forum or anything, it doesn't even have to be that you need to be an extroverted person, who keeps talking to people about your feelings and everything. You are more if you're more introverted, you could have an outlet, like you could be reading books, you could be journaling,
Mm,
you could also be just participating in the forum, but in a passive manner rather than a more active participant. I think all of that helps, yes. And finding something of interest that you like to do that relaxes you, whatever it is. Yeah. And
that sounds amazing. Yes. And I think having that support network is so, so important because often they feel so alone on this journey, and knowing that there are others that are actually on this journey too can help already, right? To make the difference.
Yes, but personality, I think, plays a role again. So if it's not really for everybody, I agree. But that's why for the others who are not so much, then the doctor and medical team helps a lot. Your partner, and also, yeah, you could just be journaling about it.
Mm.
It's really perfectly fine, I think. Yeah.
Absolutely. Absolutely. Well, thank you so, so much, Dr. Janice, for having shared so many golden nuggets in here. I'm sure our listeners love taking your good advice away from today's podcast. And thank you. Thank you for your work and how you support your patients.
Thank you.
Oh, what a beautiful and grounding conversation with Dr. Janice. I am always touched by the way she brings such a tender TLC approach into every stage of a patient's journey. From the very first conversations before conception, and then taking it all the way to welcoming that tiny little miracle earthside. She's not only a highly skilled clinician, but she is a true sparring partner, a steady anchor, and a compassionate guide who walks alongside her patients with clarity, calmness, and heart. I especially loved how she emphasized staying focused through thoughtful planning while also reminding us that life does not need to be placed on hold during fertility treatments. Dr. Janice's philosophy to keep doing the things you love and to stay connected to joy, to nurture your well-being is such a powerful message. It's a reminder that even in the midst of uncertainty, we can create pockets of light, pleasure, and meaning. If today's episode resonated with you, or if you're looking for a doctor who supports you not only medically, but emotionally and holistically, please don't wait. Her information is in the show notes. Dr. Janice and her team are truly exceptional. Thank you, my dearest friends, for joining us and sending you so much love and strength and hope on your journey. I can't wait to hear how your journey is unfolding. So please do reach out to us to let us know your personal stories. We are always here for you and knowing that you are not alone on your journey, please. Until next time, I can't wait to see you for another episode on Your Fertility Counselor. Thank you and see you next week. Thank you for joining me on this episode of the Fertility Counselor podcast. Remember, you are not alone on this journey. If you need support or have any questions, reach out to us via email at inquiries@counselingconnects.com. Don't forget to follow us on social media at Fertility Connects. We'd love to hear from you. If you want to learn more about us and the services we offer, head to www.fertilityconnects.com. And if you're looking for support beyond fertility, visit www.counselingconnects.com. Take care and we'll see you in the next episode.